The biggest impact for 2025, I think, is actually going to come from the expansion of integrative neurology and multidisciplinary care teams. So specifically, a lot of neurology is treating patients with chronic neurologic illnesses, like, things like Parkinson's disease, MS, migraine, epilepsy. And right now, we don't have, we certainly don't have good cures for those things. And a lot of our patients really struggle, I think, on a day-to-day about just trying to optimize their quality of life. And so I think, with the addition of a lot of places truly adopting integrative medicine, meaning that there's that focus on what matters to the patient specifically, and really focusing on things in addition to the medication management. So in addition to medications and procedures and surgeries, what can we do to optimize their exercise, their nutrition, their sleep, their stress, all of those things that go hand in hand, both for the patient, but also impact the caregiver as well. I think just the advances in personalized medicine are really blossoming. So again, when we think about treating the whole person and not just, every Parkinson's patient, for example, kind of having the same management plan, I think personalized medicine is really coming far with that. So, there's wearable devices that can tell us about patients and their symptomatology or whether they're at risk for something. There's, biomarkers now that are really exciting, both, for neurodegenerative diseases, like things like Alzheimer's and Parkinson's. And then I think AI, is really coming along as well, both with, just helping clinical practice. So giving us more, clinical guideline support, but also even helping with documentation to try to alleviate some of the burden that I know we all face to allow us to spend more time with our patients. I think from a Parkinson's disease landscape specifically, since that's my specialty, we recently, the subcutaneous pump has finally come out, which I know a lot of us have been looking forward to for a long time. So I've started a few patients on it, and I think it's a really good option, for Parkinson's patients that maybe are not good candidates for deep brain stimulation or want something else before, or in place of thinking about brain surgery. So that's been definitely an exciting, development. And then also just, there's now, what we're calling liquid biopsies, where we can look at blood-based biomarkers for things like Parkinson's, Alzheimer's, and, the data and the research are still coming out for those things. But I think anything where we can predict these degenerative conditions earlier is going to be huge and just groundbreaking, because then we can, instead of chasing our tails with treating the patients, we can try to be proactive and reach out to them before they have any symptoms. Yeah, I think the biggest thing that 2025 has is really folks starting to learn more and embracing what integrative neurology actually is. And so I know a lot of people, probably like myself, have no idea what that means, until I did a fellowship in it. And so just to briefly explain, so integrative neurology is basically combining conventional medicine, where we think about procedures, medicines, surgeries, with complementary approaches. So mind-body therapies, exercise, healthy eating, socialization, social connection being huge, because we know isolation makes pretty much all of these conditions worse. I think focusing on that and really emphasizing the research. There's already a lot of research out there that shows that these things are helpful and reduce, morbidity, can help quality of life. I think it's just making sure people realize that all of this is evidence-based. It's based on randomized controlled trials. So I know something that I'm interested in is really working on building a one-stop shop integrative neuroscience clinic for my patients, where they'll see a physician like myself who has integrative training, but I would also have the support of a rehab team with physical therapists, occupational and speech therapists, a dietitian, a behavioral health counselor, palliative care support, things like that our patients all need. But right now, care is so fragmented, and there's often delays to get in to see us, or, and then they have to drive around to access all these other aspects of the care team. So that's something that I'm working on building as Director of Integrative Neurosciences. And also just making sure that our patients have community support. So when they leave the doctor, are there support groups, exercise classes, healthy cooking sessions, things like that they can access, both for them, but again, also for their caregivers, so we can work on their improving and enhancing that well-being.